Oh, sorry. All right, people are pouring in. This is great. We're looking forward to a fun morning. Ooh, a lot of stuff to cover. And we know that the ride continues to be bumpy. Let's give it a couple more minutes.
You know, we should start posting polls while we're waiting to get started.
Yeah, we do have a poll to do this morning, but I don't want to miss anybody. So I'd like to get a few more in before we start it.
Yeah, no, I was meaning just like fun polls.
Oh, yeah. Okay. All right, well, let's go ahead and get started. Hey, I'm Lyle Hanna. Welcome, everybody. We're delighted that you're here this morning. And we've got a great Zoom call for you today. We've got a lot of things to cover. We're going to talk about vaccines again and where we stand in Kentucky and how we're doing. We're going to look at updates on regulations because there are a lot of things that are still in flex. We got some legislation to cover. Let's get to our team of folks. We've still got Jim is back by popular demand. So you want to change that slide, somebody? There you go.
I was trying to.
And Brad and Troy are going to do some commentary. We'll see how that goes. And Allison and Autumn's got a bunch to share, and Chase is chasing down some little questionnaires we want to run by you. And then Keith Knapp, some of you know him. He's been here before. He's not on right now because he's tied up until about 11:30. He's going to join us then. But Dr. Keith Knapp is a graduate of University of Kentucky, a PhD, and works for the UK, but he's on loan to the governor's office and actually the office of Secretary of the Cabinet. And he's going to share some more information about vaccines with us. So a lot of good stuff to cover today. Let's roll to the next slide. And basically, we're going to start out with Kentucky status. The vaccine stuff we're going to hit when Keith joins us. We may be moving on to Jim's stuff first, but then Jim's got a bunch of stuff to cover. So you know what? We'll take your questions anytime. Don't hesitate to put them down in the chat box. I want to say something about, as Autumn kicked us off, let's go ahead and put our poll up, if you will. We did this poll last time. I want to see if the needle has moved any. This is the question I'm getting most often. What about the vaccine? Can I mandate the vaccine? All that kind of stuff. We don't have a complete answer for you, but I want you to think back in history for a minute. How many of you have had polio shots, diphtheria shots, measles shots, smallpox, chickenpox vaccination? All those things have been mandated at some point or another. Sometimes just to get into school, you have to have most of those things. So Rutgers University just came out with an announcement late last week that any student coming into their university will have to have the vaccine. Now, we've got a lot of people in the United States that don't want it. I think it's mainly because it's been politicized quite a bit. But what I want to do is make sure we're giving you the very best information we can so that you can make the best decision you can. And some of you are all in favor of it. Some of you are not. We had 24% that said they would not probably get the vaccine. That's going to start creating more difficulties for them just because we know travel internationally, a lot of things that are going to be required. Some other organizations like Kroger and Toyota have put out incentives. Kroger was an early one, so was Toyota, $100 a piece. Everybody's starting to give time off for this because that's been pretty much advised. Even by SHRM has said they're wrestling with it, but they've said, certainly we ought to give people paid time off to go do this, just to encourage people to do it, to make our workplaces safer. So it's not a simple question. Let's, if you can fill out that survey and send it in, that'd be good. We're going to see where we are on this today. Let me pass it on to Autumn. Autumn is going to share with you, where are we in Kentucky now? Autumn.
All right. So we've been looking at this map for a long time now, about a year now. Last week when I shared this, or 2 weeks ago, we had 8 red. We're now down to 7 red. We have 62 in the yellow. We had 48 last time. 3 sessions ago, we had 30 in the red. So we've been making some great progress, only having 7 in the red. We now have 4 in the green over here to the west of Kentucky. Last week, the positivity rate was 3.98, and this week it is 2.88%. So great news there. So here's the vaccine status. Currently, we're in phase 1C. Bashir did announce effective today that 40 and older, the vaccines are now open to 40 and older. And that was actually expected to be in summer of this year. So we're ahead of the curve on that one. And then this chart just shows number of unique people in Kentucky that have been vaccinated, 1.31 million. So that's great. Down here, you can see the population is 4.4 million. About 18% of that is under 16 or under 18?
Under 16.
16.
Yep, under 16. So that results in about 3.2 million of adults that would be eligible. So 41% of those people have had their first dose. Yeah.
Boy, that's pretty good. Long ways from where we were, late last year. So that's moving forward. Now, Keith is going to give us a lot more details on this. He's not here yet, so pass it on to Jim. Jim, you want to look at those two? We've gotten two nice questions in there, and whoa, there's our number. Okay, how about this? Vaccine, 63% have had one or two doses. That's great. Now, you got to admit, if you've had it, oh my gosh, it makes you feel more comfortable about your life in general. So congratulations to all those folks. Interested, they're on the list, 10%. So by next meeting, probably the next 10%, we might be at 73%. That'd be great. Not interested, 22%. That number's way down from where it was. It was what, 24%, not way down a little bit. And then uncomfortable sharing. Okay, we're not trying to put you on the spot there, but thank you for that. That's good information. If you're uncomfortable, we don't want to make you more uncomfortable, but we would like to continue to provide information to people so we can continue good decisions. And what about some of these questions?
All right. So you want me to answer the questions, huh? I'm not going to. I'm not going to answer any questions. Angie, no. Is it Janae? No. Actually, we're going to talk a little bit about the FFCRA and the EFMLEA. So just stand by on that. With regard to the vaccine, Angie, we've covered that a little bit. You can ask certain questions. You have to be careful not to get into HIPAA. And I'll come back on that in just a little bit. Let me walk through the slides I do have, and we'll come back on the vaccination and the FFCRA. If I don't cover it enough, just let me know, and we'll go ahead and make sure. I'm really pleased to see the number of people on here. I told Lyle and everybody at the beginning, this is spring break for a lot of the counties, so I didn't know whether you all would join us or not. So really pleased to see a lot of people on here. Let's see what we can do. We're going to bounce a little bit, which means I'm going to do my part, and then when Dr. Knapp can join us, we're going to stop, pause, go to his, and then stop, pause, and come back. So just hold on. All right, so here we go. Governor wrangling, you all, whoops, sorry, I hit a button. There we go. Move my mouse out of the way. So we've talked quite a bit about this, and I just want to give you an update because on Thursday of last week, we had a filing from, actually Wednesday of last week, I believe, we had a filing from the Attorney General. Daniel Cameron filed an appeal all the way to the Supreme Court, skipping the Court of Appeals, asking for interlocutory relief. The response from the governor is due on the 5th of April, which is Monday. This is the injunction that was issued by Franklin Circuit Court Judge Philip Shepard. Basically what he said was you can't put a limit on the time period of the governor's executive orders. And also he said that people can't make up their own rules and adopt the CDC and so on. Where this goes right now is right here. Supreme Court's going to take this. I do not believe, based upon our makeup of the Supreme Court, that they're going to issue an injunction. I think they're going to have oral argument, and then they'll issue an opinion. It's going to be very similar to the one that was done last summer, where we had oral argument in August, and then we didn't get a ruling until the end of September, beginning of October. I suspect we're going to be looking a lot at the same type of timetable. I just don't see them rushing out something to set aside what the judge did, because there's no current emergency that's different than where it was already. We're already in the middle of a pandemic. His orders have already been extended by a different ruling from the legislature. I just don't see them rushing something out. They're going to listen to both sides. They're going to issue something, and I think we'll get it around June or July. So there you go. The next thing I want to talk about, I can't get my battery must be dead on my my clicker here, so bear with me. It's going to be a little slower. The next issue, I have no idea where this thing's going. All right, new laws. These are now laws. They have not been vetoed. These are actually in the books, or they have been vetoed, and they have been overruled. House Bill 4, General Assembly has the ability now to extend its adjournment date. The governor didn't sign it. It just became law on its own. The House Bill 190, you can now sell grocery items by food service establishments. That's now the law. The one that I've told you about before, House Bill 210, you must treat people who are adopting children the same as somebody who's having a child by birth. So that's a brand new, it is the law of the state of Kentucky. Make sure you change your policies and procedures. You cannot treat them any differently now than a birth parent. That's a huge change. It's not getting any publicity because of all the other legal wrangling. But if you run a business, you need to make sure you don't differentiate between birth parent and adoptive parent. Tax code deductions been adopted for PPP. That's now law. Unemployment insurance and the investigation into fraud is now law. Senate Bill 7, fraud prevention efforts and investigation team, that's now law. And also Senate Bill 8, which has the one that Lyle and we were talking about when all this got started. We asked you all at the very beginning in the poll, how many of you are going to get vaccinated? Well, Chase brought up a really good point, which is the new administration's talking about a passport idea. Called a vaccination passport. It's going to create a huge problem for a lot of people, because Kentucky has now said you have a right to be a legitimate objector to the vaccine. If the federal government adopts a vaccine passport, and then they say you can't go to public venues, you can't go to a restaurant, you can't go to schools, you can't go to concerts or parks or anything else without carrying around a vaccine, that is the federal government stepping over the authority of the state that has said you can legitimately refuse to take the vaccine and you can refuse to become mandatorily vaccinated. So you're going to see a lot of battles between federal and state. Basically, you've been on here for civics lessons before. I'm not going to get into it, but the federal government is supposed to be the bottom. They're supposed to be the safety net at the very bottom of society. States control every state. It's why I said when the election was going on and there was a statement made that there would be a mandatory mask requirement, and I said that's not going to happen. You can't do that. That's why they haven't done it. You can't do a mask mandate. It's also, by the way, you're getting ready to hear about OSHA here in a minute. Believe it or not, there is no update. I know a lot of you are on here for the OSHA mask update at work. It was required by the new executive order to be in place no later than March 15th. There still is not one. I was asked this morning, why is there not one? I believe it's because they realize it would be unconstitutional, it would be invalid, it would be shot down in a court of law. So they're trying to figure out a way to do a national mask mandate at work without usurping the state's rights. So you're in a situation right now where they can't figure out how to do it legally. So they went with the interim measure that we talked about last week or 2 weeks ago, the threatening, intimidating, they're going to be investigating you, they're going after industries and all that kind of stuff because they can't come up with any other method to enforce their mask mandate that they want to do. So, American Rescue Plan. I know I've talked about this a little bit, about this particular extension. This is the one that just got adopted, the $1.9 trillion, of which only about $500 billion actually went to COVID. If you're interested, take a look at what the state and local governments are getting. We talked a little bit about it the last time. The one that really blew my mind was Fresno, California. Pull it up and take a look at it. They had a total of, and I don't have the figures, but let's say they were $30 million in debt, and now they're getting like three or four times the amount of debt that they had. So my question has become, if you're getting this much money, and anybody from the LFUCG, I hope that the council's listening. If you're getting this much money at a state or local government, you need to start cutting back on our taxes, because it means you don't need any tax revenue, because like Fresno's going to be in the black by like 4 times the amount of debt that they had accumulated over the last decade. If that's the case, we shouldn't be taxed. If the schools are getting billions and billions of dollars, then our taxes on our houses should go down. So start pushing for that in your local communities, because they are getting a windfall of money, which means they shouldn't be taxing their residents in those counties, states, localities, schools, and so on, because they are flush with money right now. Everybody's getting free money left and right. So here you go. Here's the new update. There are several provisions in the new American Rescue Plan, as it was called, the ARPA. They come up with all kinds of cool names in the past. This one really just is ARPA. Doesn't mean anything. It's kind of just a lot. So it did impact the FFCRA. After December 31st, as you will recall, you're no longer obligated to issue FFCRA leave. However, the one signed by Trump in January, the Consolidated Appropriations Act that was passed at the very end of the year, beginning of 2021, executed, I believe, I want to say it was January 13th, I'm not positive. It extended voluntarily through March 31st. Well, the American Rescue Plan extended it through the end of September. For any employers with less than 500 employees, we're going to extend it through September 30th. Tax credits are available for all of the old qualifying reasons that you've heard us talk about for months on end. If you need more information, go back to, I want to say it was the 4th week that we did this, maybe the 5th week. We talked at length about FFCRA, EFML, EA, what qualifies, what doesn't, how do you do it, what if the schools are closed? Well, that's now changed to schools being affected, and that's here in this part right here. So you can now allow for up to 10 new days, 80 hours. That's under the FFCRA. The EFMLEA or EFMLA or just FMLA was originally limited to school closings. Now it's expanded to include any and all FFCRA leave, so keep that in mind. Also, the EFMLEA leave, all 12 weeks are now paid instead of the first 2 weeks not being paid and then the last 10 weeks being paid. Everything's paid. So what does that do? That means that, and this applied to the vaccine side, I want to make sure you all know, all of the old plus vaccine. What does that mean? If you send somebody for vaccine, that's covered. If the person gets a flu-like symptom as a result of the second vaccine, which is when it's hitting most of the time, that's covered. If the person has any symptomology, that's covered. If the person needs to wait to come back because they are being tested and they're awaiting results, that's covered. It literally now applies to vaccines and testing, not just the symptomology that went with it before, and schools don't have to be closed. It's for any and all reasons set forth under the original. It's expanded that way as well. The American Rescue Plan puts some limits on the employer tax credits, and that is if it somehow favors highly compensated employees, or if it's in favor of full-time employees and not part-time, or if the basis of the employment tenure is the basis for leave under the policy. In other words, if you discriminate at all against anyone else, then you're not eligible for any of the tax credits, so keep that in mind. How they're going to enforce that has not been set forth yet. The IRS has not come out with anything regarding the American Rescue Plan, except for a little note that says, stay tuned, we'll update you soon. So we're waiting. Still waiting. So they are not very quick right now to come up with their new policies. Basically, everything is just thrown out there and wait for the next thing to come. Employers need to make sure that they decide whether to voluntarily offer the FFCRA, but understand that if you're going to do it, make sure you're absolutely fair about it. Just a reminder, tax credits are available to private sector employers with fewer than 500 employees. This didn't necessarily apply to everybody, so I didn't include it, but your tax deadline is no longer April 15th. It's been extended to May the 17th, I believe. That is not for businesses. That is not for everybody else. It's only the individuals. I could be wrong on that because they've also talked about extending it for other things. But the last time I checked that, it was just individuals. That's just a little information, so don't be rushing on your taxes because you get an extension on that. OSHA. National Emphasis Program. I talked about this 2 weeks ago on the 15th because it came out on the 12th, and I said, stay tuned because sometime today, the 15th, they would come out with their new emergency temporary standard. If you remember when I talked to you about this middle of February, I told you the emergency temporary standard is a very dangerous, very limited use under OSHA. The last time it was used was for black lung disease in mining because of the issue that was causing in eastern Kentucky and in Pennsylvania, West Virginia, and so on. That was the last time this was used. So the emergency temporary standard is a very dangerous overreach from the federal government. It takes precedence over state. It takes precedence over all other rules. Doesn't matter whether you know about it. It literally is, we are controlling this because of the risk to the employees, and therefore we're stepping in and we're going to just tell you what to do. Well, that's what they said they were going to do on January 29th in the emergency or in the executive order. We would have a brand new ETS for mask mandate nationwide, all businesses. Everybody's been waiting for it. I don't think they've done it because it's illegal. That's why I've already told you before. They came out with this national emphasis program on March the 12th, and everyone thought, oh, that's kind of cute. But when are we going to get the second shoe to drop? Well, the second shoe hasn't dropped, which is even scarier because now you have a national emphasis program. Has no definition, has no guidance, doesn't tell us what it's about, doesn't explain to us what it really means. All it says is we're going to step up enforcement. If you're in an industry that is at high risk, if you have any issues, or if you're in a program that exposes people, program meaning business, that exposes people unnecessarily, we're going to crack down on you. We're going to scrutinize you. We're going to punish you. We're going to go after you. The problem is there's no structure, which basically means they can cherry pick whoever they want and go after whatever industry they want, whatever entity they want, or however they want to do it. I can't give you guidance when there's nothing out there but a national emphasis program because it has no basis in there to explain to us how it's going to be enforced. It has no structure to it as to how it's going to happen. So we're in a limbo time period waiting for the ETS, which I think is still coming. But meanwhile, they're just threatening you, literally saying, we're going to step up, we're going to scrutinize, we're going to enforce and target, use the phrase target like 10 times in 4 pages. That's scary because that's our government targeting private business. Anytime you hear the word target and they're telling you we're targeting, that's a frightening proposition, but that's where we are. They have not issued the ETS. So they talk about high-risk industries. They talk about high-risk activities. They then talk about they're clamping down on those that are not strictly following COVID-19 instructions. From who? CDC? Because they're issuing 30 to 40 guidelines a day, and it's impossible to follow. But now you as a business are expected to follow all of these, or you're going to be substantially scrutinized by the OSHA for your business. Now, if you're smaller, obviously you have more leeway. If you're running a factory, follow the best practices you can. Try to keep up with CDC, try to keep up with the EEOC. It's becoming very difficult, but that's the only guidance I have. This less formal, it sounds great because it's not formal, but then it's scary because it's not formal, which means how do you enforce it? How do you guarantee compliance with it? And how do you as a business make sure that you're not doing something wrong? It creates some problems. So, I think I covered everything on there. Yeah, this is the last one down here. You need to be aware of the fact that this is going to pop any second, and it is absolutely enforceable the second it's adopted. There's no lead time, there's no public discussion, there's no public scrutiny. If they come out with an emergency temporary standard, until it's set aside, it is law, and you are expected to follow it. So keep listening to the news, keep watching for OSHA to come out with the ETS. I literally expect it any day, any minute, and it's going to change how you run your business, because they will, at least at the beginning, have mask mandates on there. I just don't know how they're going to enforce that. So, all right, we have a lot of new changes coming out. Some of this is just to keep you informed ahead of time. Some of this is drastic change because it literally is a 180 from where you were 2 weeks ago. So the first ones, we're starting out with the absolute throwing out of everything that you thought was normal in January is now not. So if you run a restaurant, if you run anything where you have tips, if you run anything where you have tip pooling, listen up really carefully, because this is brand new. It happened on Thursday of last week, and it changes everything. So the Wage and Hour Division issued 2 new directives. Those 2 new directives, one is no more tip pooling, no more leniency, and not only that, but now you're going to get hit as a business with double penalties, and we'll get to that in a second. The other one is called the 20% rule. I didn't spend a lot of time in January on this because it was adopted in January, and I knew it was going to be scrapped in January. So with the 20% rule, now I will cover it because it impacts you tremendously. What the 20% rule was, if any of your employees went over 20% of time spent on things that they were not servicing customers where they could get tips, then you had to pay them a different rate. They were not a tipped employee. You could not rely on tips to pay them. That's filling of salt and ketchup containers, rolling of napkins, cleaning up the back area, meetings, going over the lunch specials of the day, anything where they're literally not meeting face-to-face with customers. That was thrown out in January, saying you no longer had to follow the 20% so long as this was tied to immediately before or after the regular work schedule, as long as the employee had a reasonable expectation this had something to do with the regular job. Then you didn't have to follow that tip time, the 20%. It also was very difficult for employers to track because you had to literally monitor every second of the day. And so it was thrown out as a cap in the past. That got reversed on the 25th. So now you cannot use the 20%. You have to pay your employees differently. You have to track the 20%. And if they're filling salt, if they're filling pepper, if they're filling ketchup, if they're rolling silverware, you can't use that. If this applies to you, be very mindful because they're going to come after you. The second one is the tip pooling. So in January when this was adopted, you were allowed to tip pool. What that meant was you have a whole lot of people in the back that help you out. Bussers, cooks, chefs, people who are the delivery to the table, but they're not the server at the table. There was a rule passed that allowed you to allow tip pooling so the people in the back office or the back kitchen could participate in that. They could benefit from the tips that were being given. New administration has thrown that out. You can no longer tip pool. You can no longer tip share with the back support team. The other thing that it did was it declared that they're intending to withdraw substantial portions of the 2020 rule, replace them with language that significantly expands the authority for the Department of Labor to assess money penalties. What they've done is they have deleted this part, repeat or willful business. So now what you're going to be hit with, if you engage in any activity that the Department of Labor, wage and hour, local, state, federal come up with that you didn't pay your employees correctly, you will owe back wages, which is what you owe under the statute anyway. You owe what's called treble damages, which is liquidated damages. It's 3 times the amount that you owe that you didn't pay. So let's say you took $100, you're going to owe the $100 plus $300 in what's called liquidated damages. Well, now they've thrown this one on top. You will now owe the Department of Labor civil money penalties. So you're going to get double penalties from the Department of Labor plus the liquidated plus the back wages. They're going to start coming after everyone that runs a business for anything that is employee-based. This is going to start to turn into a very strong unionization effort nationally. Why do you say that? Well, here is why I say that. Let me go to this. I'm going to skip a slide. Dr. Knapp with us yet?
Nope. Don't
Yes, he is.
Okay.
Oh, there he is. Okay.
Let me cover one thing and then we're going to skip and then we'll go back to the slides that I have.
Right.
This one right here, if you run a business, is the single largest development in the last 2 months. Martin Walsh, if you don't know who he is and you run a business, you're going to find out very, very soon. He is a union representative. He represents unions. He is now the Secretary of Labor. If you don't know what the Secretary of Labor does, and you don't know what the impact is to have someone who is in the union as a Secretary of Labor, your world is about to change because this means he does support $15 an hour minimum wage. They've already rolled back, this is all in the last week, they've rolled back independent contractor classifications. They are now enforcing joint employer situations, which mean that you can be found to be liable even though you aren't the employer of record because you have some modicum of control over the day-to-day affairs of that employee. They've rescinded the opinion letters. They've rescinded the payroll audit independent determination program. They've rescinded the industry recognized apprenticeship program. He is in favor of the $15. He's in favor of a whole lot of other substantial business issues. All of your anti-union activities, or what we call, when I'm training, pro-employee, are out the window. All of your protection of unionization efforts are going to be enforced. All of your top secret voting for unions will be back in place. Businesses will not be able to address unionization efforts in the same way. This is the single largest development for you as a business. This is not a political statement. This is just fact. Martin Walsh, as the Secretary of Labor, means businesses have to change all of their handbooks. They have to be aware of all of the Department of Labor activities, because all of the business-friendly environment that you thought that you had for the last really 8 years is gone. The Department of Labor is going to enforce pro-union, anti-business developments, and you need to be aware of that and ready to address that. We'll come back to the substantial, these other ones on this page, the Dreamer, the Farm Workforce Modernization Act, which sounds like a great thing. These things change your landscape, everyone's tremendously. We'll come back to that. We'll switch right now to Dr. Knapp, because he is more important than I am. There you go.
Wow.
And you can study up on the questions we've gotten while we're at it, while Keith is speaking. Keith, Dr.
Sure.
Knapp, it's so nice
Hey,
to
hey.
have you here.
It's nice to be anywhere.
We appreciate it. It is. The alternative is not that deep, is it?
That's right.
Tell us what you want to share with us today.
Well, sure. I got a chance to look at the slide deck a little ahead of time, so it looks like you've covered already a lot of really
Just a little bit.
important and contemporary information. So, man, this is really great. I'll be quick so you can return to finishing the discussion I was hearing just as I came in. I give you kind of a pulse check, vital signs check on what's going on with COVID, all things COVID. Of course, my scope is pretty focused on Kentucky, and what I know about other states is really just in relation to how we stack up, because that's something we monitor as we go on. So if you're on the call and not from Kentucky, I apologize with that flavor of it, but it's for the most part pretty indicative of what's going on across the country at different rates. Start with the good news, you know, the things you're seeing on the evening news, the new cases and number of people dying each day from COVID is dramatically declining. It's still shocking high number of people, but it's not nearly what we had at the peak 90 days ago. Indicative of that, you know, hospital capacity is not being all overrun by new COVID cases. We still have a significant number of people in ICU are being treated. Some have been through the ER, but nothing like we were just even 6 weeks ago around the country. I'm going to talk a little bit more about positivity and incident rates and the difference between them in just a minute, but know that the things we track, the metrics we track about how many people are getting sick is on the decline as a percentage of the population. And for those businesses, particularly in my field of long-term care, that rely on that metric for how often and how many people were testing for COVID, that has a huge financial benefit, because we've dropped to nearly 25% of the frequency and volume of COVID testing required by the CMS and CDC for long-term care facilities since January. So that's a big decline and has some real operational advantages. The vaccination hesitancy is declining a little bit, but it's sort of plateaued. And so I'm going to finish talking about the importance in the role that HR professionals can play in trying to, without heavy-handedly beating people over the head, but just this side of that, get folks who are hesitant to find out why they think it's a bad idea or why they're fearful, and address those in ways that don't demean or ridicule or make people uncomfortable, but get them to move toward action. Vaccine supply, go ahead.
Keith, we had a little survey before you got on, and it showed we used to be 24% didn't want it, now 22%. So not that much. There you go.
Well, that's 10% of 24.
Yeah.
10% of the 24 moved along. And I think that'll continue, but it's a little slow go, and for very different reasons in different pockets. So you can't really have a single public service information campaign that is going to capture all the people who are the doubters, because some have very different motivations. But access to the vaccine is, improving daily with the advent of the Janssen Johnson & Johnson vaccine, because if it's ease of handling and wider distribution, the more they make of it and the faster they make it, the more people I think will probably be able to reach. Did you show the SNL clip from Saturday Night Live?
No, I felt like that was
Well,
inappropriate in
if
some
you haven't
ways.
seen it yet, Google Saturday Night Live from this past weekend. They had a cute clip on there about all the boomers now having been vaccinated and were out moving about the cabin freely. So there are metrics that we're big on measuring stuff in healthcare, and one of my chief criticisms of what we measure is that some of it doesn't really matter very much. It's measured because it's easy to measure, but that doesn't mean it tells you anything about what to do about it. And so I'm going to give you just kind of a 40,000-foot view on the things that are being reported in the news media that are interesting to know, but they're not really all that useful in terms of what we're going to do with that information. So on the left-hand side of this slide, we've got the things that we're tracking that really can help public health officials and just individual citizens make decisions about their own future with respect to COVID. And then some of the things that get reported that are just kind of interesting, but out of context, they really don't mean very much. So on that left column, the number of vaccines given is interesting, because it's a big number, but unless you have it in the context of how many vaccines were distributed to the state to give out, it can sound like, well, we're not making very much headway here. And so depending on how it's being reported, it'll either be the glass is half empty or the glass is half full. Yeah, 1 million doses were given. Well, that doesn't sound like very much when there's 300 and how many million Americans. But if there were 1 million doses given and there were only 998,000 vaccines made this week, that's pretty darn good. So the percentage of vaccines given as a function of how many were manufactured is a better measure of how we're doing on the vaccination effort. Now, do we need to ramp up production? Sure. And they're doing that. We got some of the competing pharmaceutical companies that didn't really come up with the vaccine itself, but using some of their facilities for manufacturing, especially the Johnson & Johnson vaccine, so we can push that out in bigger numbers. And so one of the limiting factors still is how much vaccine do you have to put in people's arms, even if there was a line at the door. So that's an important distinction. Incidence rate versus positivity rate. You'll hear both of these reported. Different states are using these different measures. A positivity rate has in its denominator how many people got tested. I'm sorry, how many people got tested versus how many people went up positive. Okay, so the percentage of people who were positive of all those who got a test. That's a positivity rate. Incidence rate, which is really more useful from a public health standpoint, is how many new cases were reported per 100,000 population. And when you have a normalized measure like that, per 100,000, it allows you to compare apples to apples for a little bitty county versus a major metropolitan area on how do they compare to one another on a per 100,000 basis. And so that's a more useful measure typically. Uptake rate is the percentage of folks that could get the shot that are getting it. And that's important to know that what goes in the denominator on that rate is how many people are there total. Hesitancy polls that are out there, and there's a link that I've listed here from a great little PSA that was made by a local nursing home here in Lexington, Sayre Christian Village, that has one of their nurses giving a testimonial for why she's getting the shot. And it's a 2-minute and 20-second clip. It's out there in the public domain. It makes a great case by someone who is both trained as a nurse and had COVID, and why she's getting a vaccination. So it's a great tool. And I think, does everybody get these slides, right, Lyle?
Yes, yes.
So you should be able to click on that and get it. An important measure, probably more of the glass empty, glass half full for our purposes is how many people have recovered from COVID-19. It is tragic how many people have died, but unless it's in the context of how many people got COVID, our batting average is pretty darn good or it's improved on how many people are getting it and not dying from it. You understand what I'm saying?
Yes.
Early on, nearly anybody who was over 60 who got this disease could reasonably expect to die from it. And now that is less than half as true as it was this time last year. So that's a big improvement from a public health standpoint. Doesn't mean you're, risk-free. And still, for every 10 years of life you add after 40, your chances of dying from COVID, if you get it, double. So older adults are still highly at risk, despite the SNL clip that we were talking about earlier. But vaccination sites have improved. We've got over 1,000 of them here in Kentucky now, and that's happening everywhere because of some of the phenomena I mentioned earlier. And what class you fall in, the priority group, whether you're 1A, B, or C, or 2 or 3, that's really becoming less important. And really along about the 1st of May, with the proliferation and production and the more sites that are going to be available for public access to getting a vaccine, what group you fall in is going to be pretty immaterial by Derby Day. We measure time here in Kentucky by pre-Derby and post-Derby because we're really going to have it this year. And then the last thing that I'll just offer as a suggestion is while national benchmarks are reported on the national news, of course, and sometimes local reporters will say how we stack up against the national benchmarks, there's so many variables in the things that I've mentioned listed above here that probably a better thing to measure your state's progress and status is what's going on in the states that touch your state. Kentucky has one of the most number of contiguous states. We have 7 that surround our border. And so keeping track of the contiguous states is a little bit of a chore. But if you have an idea what your border states are doing, the impact that most likely has the greatest is in the counties that touch that state. So in our instances, even though we have 120 counties, nearly 2/3 of those counties are around the perimeter. So they touch another state. So knowing what's going on in the other state is a more useful thing to know than national averages that are, influenced by huge population centers like New York and California and don't really have any bearing on what's going on here. Next slide, please. Or do I have control?
Oh, there you go.
Okay.
Tim's on it.
I thought it'd be helpful just to list a couple of reliable and accessible sources for information because these get updated as there is new information. I didn't put the actual URLs on here because they're pretty self-explanatory. If you just Google one of these on the left, and if you're here in Kentucky, there's also a toll-free phone number there for getting information on the latest. But 3 that you might not be as aware of that are out there and that public health officials actually consult because they've done such a great job of putting their information together. One's the Becker Hospital Review, and it doesn't have just hospital information, but it has really useful public health information about COVID-19 and how states stack up against one another on a variety of measures. One of those being vaccination effort. What's the percentage of vaccines that were distributed to Kentucky that actually got in a person's arm this week? You can find that information at the Becker Hospital Review site. Similarly, I've heard a lot of complaints by people who say that they haven't been able to find a place to get or haven't been able to successfully sign up for going to get a vaccine. Honestly, Pete, the 2 best, most useful and user-friendly sites are the one run by the National Public Radio people and by, believe it or not, NBC News. Now, I'm a big Lester Holt fan. I watch his brand of the evening news pretty often. So I'm not on commission from NBC to steer you in their direction. I think most of the networks have done something, but theirs is the most comprehensive about finding a way for you to get vaccinated. So if you're talking to employees and they're having difficulty, that's not a bad place to start. It'll lead you to resources in your state that will be successful, I predict. These next couple of slides are right off of the internal Department of Public Health reporting to the governor's office from Friday. And I'm not going to bore you with a bunch of numbers other than to say the trends I said on the first slide are borne out with our reporting, and that things that are looking up are really, really looking up. There are a couple things that are plateauing just a little bit. One of the important distinctions that when you drill down into the weeds just a little bit is where this purple arrow is new persons vaccinated right now generally means first of 2 doses, because the Moderna and Pfizer products require 2 doses a couple of weeks apart. This is going to be a tougher metric to track as we go forward with the proliferation of the J&J 1 dose, because new person will mean just that. We added another person to the fully vaccinated. One word of caution for HR that kind of is in the footnotes for everything you hear about the vaccination, but doesn't get enough play in my view. Your full protection from the vaccination, whether you're getting the 2 dose or the 1 dose, really happens between the 10th and 14th day after the completing dose. So you're not really fully vaccinated when you walk out of having gotten the second dose. It's that plus 10 to 14 days. That's important in trying to coach people about their behavior, because I can't tell you how many people I've seen, even at Kroger Field here in Lexington, who, I worked down there Saturday, and they walked out of there like they had just been healed and now can go out and walk down the street, throw away their mask and, move about the cabin. That's not what that is. It means your body has yet to get the second set of responses to maximize your protection. Similarly, with the 1 dose J&J, 10 to 14 days post-vaccination is really when you're peaking and you're getting full protection. So it's not to say you're not protected at all, but you're not done yet. And that's an important distinction. The other thing about vaccine, I mentioned this last time, that people don't seem to really get fully, is that this vaccine, these sets of vaccines, do not prevent you from getting the disease. They are not designed to do that. The science of their design is to get your body to respond by developing antibodies that will lower the risk of you getting severely ill or dying from it. That's different than not getting it. And so when you hear alarming reports on the news about somebody who got vaccinated then also got sick, that is scientifically possible, but they're not going to get, in all likelihood, as sick as they would have if they hadn't gotten vaccinated, or even less likely to die from it than if they hadn't gotten vaccinated, but not from getting it. So I just want to get that lick in.
And Keith, I heard Fauci say a few days ago that no one had died that has had the vaccines.
The J&J, yeah.
Is that J&J? Okay. And that's not from having this vaccine, but no one had died. I thought what he was saying was no one had died.
Oh, you mean being caught by the vaccine? Yeah, there was a news report about somebody here in the last couple of days about that, and they're still investigating it. But yeah, that there's not been a verified death that could be attributed to having gotten vaccinated. Correct.
And I thought he was saying that no one had died of COVID that has gotten the vaccine. Once you've had the vaccine, people may still get sick, but no one had died of it. That's what you're saying, right?
That's true of J&J, yeah.
Okay, all right.
It's not true of the other 2.
And we don't know about the other 2, or
now there's a couple of isolated incidents that, it's really hard to produce the science of somebody who's got 7 multiple chronicities, concurrent illnesses, and say that COVID is the primary cause of death, or that the vaccine was the primary cause of death, because there's too many other possibilities in that mix.
Got it. While I've interrupted you, somebody did just ask a question about what's the percentage of seniors in the state that have had 2 doses or, fully vaccinated?
You know what? I think if we go 2 slides further,
Okay, I don't mean to jump you ahead then.
No,
I
no,
forgot.
that's fine. That's fine. This is just a cumulative chart. Here's the chart I was talking about. They give you a little bit of an idea of the
Yep.
distribution of the vaccines. We're bumping upwards of 2/3 of seniors have been vaccinated in Kentucky. And a large part of that was helped by the nursing home effort. We went pretty aggressively after nursing home residents and senior housing congregate care settings where we'd had a lot of illness and a lot of death, frankly. And now those are in the 85, 90% vaccinated within that subset. So they're really well covered with respect to this. Most experts that I've read seem to think that herd immunity is going to land somewhere between 70 and 75%. And as a nation, we've kind of plateaued at 43%. So we got some work to do.
Yep.
All right, I want to be sensitive to everybody's time. I can stay as long as you need me to, but let me bump forward a couple more slides here to a wrap-up slide. This is more numbers than you can use. I did want to mention, here's what I was talking about earlier. You know, we now have over 1,600 places you can get a vaccine. What we don't have is enough vaccine. So they're getting distributed as we get them, and we learn on Sunday night what we're going to get on Tuesday, and what comes off the truck may or may not match the manifesto of what we've been told is coming. So we have to pivot each week on making sure that they go to these different places in sufficient numbers that people can get the vaccine. Now, what a lot of people have figured out is that for your friendly retail outlet, local drugstore, Walgreens, CVS, any of those that are participating in either the state or federal or both programs, they would rather give a shot late in the day to somebody who wasn't on the schedule than waste a shot. And so literally, if you call late in the day on a Tuesday or Wednesday, because that's when the new shipments go out, you've got just like, there's certain days of the week and times when you can get the best job get the best seat on an airplane. That's the sweet spot right now for calling and saying, hey, if you have any leftovers, any surplus at the end of today, I can be there in 20 minutes. And I bet you $1 to a donut, a Krispy Kreme donut, that you'll get a vaccine, because there's that many no-shows.
Cool.
Yeah. Speaking of Krispy Kreme, I guess you heard by now, Krispy Kreme donuts, and I am not on commission for them, but if you show up with your vaccination card at a Krispy Kreme donut shop, you are entitled to one free glazed donut every day till the end of 2021. So if it's not COVID, let diabetes get you. All right, so the next challenge is really, in my book, are reaching prematurely a level of overconfidence and complacency. We've already begun to see a little bit of that with some of the phenomena I was describing earlier. And I mentioned that the protection is not an infusion of superpowers. We need to finish the job and get up in that mid-70s% vaccinated in order for it to really have its intended effect. What I wanted to part with is a couple of suggestions from an administrator to HR professionals about the areas that I think are likely opportunities for review in your policies and procedures, regardless of industry. One is emergency preparedness. What have we learned from this whole episode that would modify what our response is in a pandemic? Because most experts seem to agree it's not going to be another 100 years before we see something of this magnitude. And having some idea of what worked and what didn't work this time around is probably good to codify in emergency preparedness policies and procedures. Looking at hiring, qualifications, and testing. A lot of us have put in place pre-employment testing for illicit drugs to other kinds of things, as well as, is negative COVID tests going to become part of that or not? And if not, why not? Looking at sickness policies, sick leave policies, and whether it's a good idea or a bad idea for somebody to come to work if they're not feeling good. You know, jury's kind of out on that, but it's something worth having a conversation around, and how your PTO program might work. And then one that really has been a difficult one to manage in the long-term care sector has been attendance and punctuality policies. You know, if we had a hard line that this number of absences was going to result in disciplinary action or even worse, termination, do you suspend those altogether, or you rethink what it means to be a perfect attender, or, you know, what's bad enough to result in what kind of sanction? And then one that has really come out in spades during the pandemic is employees who have multiple jobs. And, you know, I mean, you can't restrict them from having other positions, but at least having intelligence around knowing where else they're working. Because what we found with contact tracing in Kentucky with healthcare workers is that most employers did not have that knowledge about their staff. We know they're on our payroll. We don't know that they're on 7 other nursing home payrolls, and that they're taking shifts sporadically elsewhere. And it only became clear through contact tracing that that was a major source of spread in urban areas among long-term care facilities. And then the importance of cross-training people to do multiple jobs so that you have the flexibility of having somebody out for any extended period of time, and they're the only person that knew where stuff was or how this works. Is, you know, some ideas that I have that I'd try to share with you. I'm looking at the chat box here.
So, Dr. Knapp, I went ahead and put up the 2 mandatory things that you said had to be on the screen when you finished, so that the Krispy Kreme and the NBC News sponsors were happy with you. Is that? Just want to make sure everybody understood that the sponsorship is covered.
Yeah, we'll have to hit them up for some help on this. So thank you for letting me share with you. I'm sorry I couldn't be here for the whole thing today, but I'm going to stay on the line in case others either have questions, or I want to hear what the rest about what James has to say.
Thank you very much, Dr. Knapp. Appreciate it. And one of your fans joined me during this. My wife's a big fan of yours, and of course, so she joined me just to hear what you had to say. So we really appreciate it. If you have other questions, don't hesitate to put them in the chat. Jim, you got some stuff to cover.
Yeah, I don't have a whole lot more to cover. I covered a lot of it, but just to pick up where we were, we talked about the Department of Labor wage and hour regulations, and we talked a little bit about the brand new Secretary of Labor. And stay tuned, because that's literally just happened at the end of last week, and you're going to see a lot of changes in the next 2 weeks to a month from the Department of Labor. So let me go ahead and cover some other interesting things for you, because the landscape for business is changing drastically. The border and the issues with immigration impact businesses more than you realize. So you may not think that things apply to you, but they do. This was brand new. So on the 9th of March, DHS came out and set aside the public charge rule. I covered the public charge rule with you late fall, early winter. What that was basically was, if you are on the public dole, you're not allowed to apply for green card status, permanent resident status, or citizenship. Well, the DHS has changed that. So if you have any employees that were looking at becoming citizens or going through the process, and you had issues related to that individual being on the public welfare, whether that was food stamps, Medicare, Medicaid, or any other public assistance, they were required to fill out a Form 944, identifying all sources of public monies that they were receiving. The new administration has set that aside, has scratched completely the public charge rule, so all immigrants are allowed to apply for permanent resident status or citizenship without any consideration to whether they are receiving public monies. So that you understand what this was about, in the past, it was 50, 60, 70, 80 years ago, there was a position taken that anyone that comes into this country should be able to assist this country, should not be a drain on the country's financial status. So that's been the policy for 200 years. That was something that was implemented recently, again, declaring that, look, the way we can verify this is we shouldn't be taking people on that are going to be a further drain on our taxpayers and on the debt. That's been thrown out. So now if you have anyone in the status pipeline, no more limitations on whether somebody's receiving public aid. They're now allowed to apply. The other one is, and this quote kind of shares where it is in terms of the new administration. Mayorkas, who is the new secretary, said, an individual who has access to health benefits and other government services available to them should not be precluded from applying for citizenship. That's, quote, not in keeping with our nation's values. They also then advised that additional reforms are going to be implemented in the very near future with regard to additional immigrant status. Following this announcement, the USCIS came out and said that the 944s are going to be voided. If you had a request pending, you no longer have to answer it. You don't have to demonstrate that you are self-sufficient. As an immigrant status, it's an open book without any self-sufficiency demonstration. Then the last one is, well, that's the same kind of thing. They literally declared it in 3 different things. They said that they would not require proof, immediately cease application, and public charge will no longer be considered. So that they not only said it once, they didn't say it twice, they said it every which way they could. Other new regulations, new business changes. Some of these are in the process, but with the House, the Senate, and basically the end of the filibuster rule, this is really going to become quick adoption of these things. You need to be aware of them as they become adopted. So the Senate Committee on Judiciary held hearings on the Equality Act on March the 17th. The Equality Act is going to formally adopt discrimination prohibition based on sex, sexual orientation, gender identity, and any of the other LGBTQ bases. So the Equality Act is one that is in the Senate. It's already gotten through the House, so be aware that that's going to become law sometime soon. On the 18th, the DREAMER Act was passed. This is in the House. Stay tuned because it's going through the Senate now. It would provide a pathway to citizenship for all Dreamers, as well as recipients of the temporary protected status. So this is kind of the end game of the Dreamer issue that had been going on for a number of years. Also, as an aside, I didn't put it in here, but the Department of, I think it was the Department of Labor, but they abandoned all of the appeals regarding the Dreamer Acts. So basically, anything that the previous administration thought should be in there has been scrapped, and they're basically not challenging it any longer, which means it goes back to the district court and will no longer be fought by our Department of, actually our Justice Department, sorry. The third one, the Farm Workforce Modernization Act, which sounds great. Basically what this is it's now a new way for pathway to citizenship for anyone working on farms. In the past, there was a temporary work visa for anyone who was working on farms. They could come in from Mexico. They had to leave when their work was done. They could come back the next year. They could work on the farms, and then they could leave. This now is allowing full-blown citizenship for all of the people working on the farms, not just temporary visas. So that's going to change your landscape on the people who are working for you, because it's not just the farms around here. It literally means additional citizens, not just temporary visas. So that'll change all of your H-2As, all of your visas, and so on. The Department of Labor Employment Training Administration announced a further delay in the strengthening wage protections for temporary and permanent employment. Basically what that was is the previous administration wanted to stop the influx of the farm workers, of the other types of workers. They wanted to demonstrate that you had a legitimate need for the employee to be here before they would allow people to come in on various visas and citizenship applications. That's all been scrapped, and now we're back to basically I don't know how else to put it. It is open borders. It's not just at the southern border. It literally is, if you want to apply for any type of work, if you're an employer looking for any type of immigrant to come and work for you, now's the time to do that, because the delay in this enforcement means that there's no protection now for the American workers with regard to the immigrants that were being stopped from coming in. That's not a political statement. That's just what that policy was. The strengthening wage protections was intended to stop the pressure of having cheap labor coming in. That's been scrapped. Through at least, and look at the date, it is not a typo, it is at least November 14th of 2022. Meaning a year and a half from now, not 6 months. Then we've already talked about this last one, the adoption or the approval of Martin Walsh. He was the mayor of Boston. Before that, he was very, very heavily involved with unionization efforts nationwide, including in the Boston area. He is considered to be extraordinarily helpful for unions and very much against business operations without unions. So take that for what it's worth and be prepared, because those are going to be changes to the NLRB, changes to wage and hour, changes to the Department of Labor, and they get to pick and choose what they're going to enforce and how they do it. So we're going to have a lot of changes over the next few weeks and months. More changes that are on the horizon. So the Senate is working on undoing the EEOC conciliation rule. This is huge because we talked about this. The EEOC was required under the previous administration to open up and be transparent. We had a whole lot of lawsuits that have been going on where the EEOC would just sue a company and not even explain, how did you get here? What did we do? What evidence did you find? They literally were just hiding it. For a business, that's kind of scary. And so what this was a conciliation rule that said, look, before you file a suit, you have to try to negotiate. Before you negotiate, you have to share with the employer what you know. You have to talk to the employer. You have to try to work with the employer to fix things, not just rush out, sue them for discrimination, and then get some kind of judgment from a judge and go after the company. So they came out with the conciliation rule. I talked to you about it, I think, in November, December, that this was a good rule. It had been adopted, and it required transparency. You have to actually talk to the employer before you're threatening them and going after them, have to go through mediation, have to try to settle things. Well, the Congressional Review Act allows Congress to go through and change things for certain administrative agencies. What they've done is they are now trying to push through the Congressional Review Act a rejection of the Conciliation Act, meaning less protection for employers, more threats from employees. What this will do is it will make the EEOC go back to the way that it was, which is no discussion with the employer, no sharing of their findings, more lawsuits, more threats of lawsuits, more Department of Justice involvement. And if that gets done, then it will go back to the previous directive, throwing out the one that just got adopted. Then on March 24th, just last week, the Committee on Education and Labor moved forward with the Pregnant Workers Fairness Act, the Paycheck Fairness Act, and the Protecting Older Workers Against Discrimination Act. What are those? Pregnant Workers Act basically says any worker who could do the work but needs to have additional reasonable accommodations, that applies for anyone who's pregnant. So childbirth, pregnancy, or any related condition, you have to give them accommodations. It's not a whole lot different, but it's going to be more robust than just the Americans with Disabilities Act and the FMLA. So stay tuned for that because that's a big change. The next one, the Paycheck Fairness Act, it limits the employer's defenses under the Equal Pay Act. It requires employers to do a whole lot more submission to the federal government on your employee compensation data. It allows the Department of Labor to come in and demand more documentation from you and for you to have that at your readiness for any demand from the Department of Labor. And then the Older Workers Against Discrimination Act. That is intended to amend the employment law to allow any plaintiff to establish unlawful employment practices, not just by showing that it was the motivating factor, but they're going to reduce the required proof for an employee to a factor in the practice. It has always been the motivating factor, or the majority of the employer's basis was age, race, gender, sexual orientation, disability, whatever. They're changing that to one of several, and this could change, if that gets adopted, that could change the entire landscape of discrimination law, because a motivating factor out of 100 allows a jury to find against you, even if they think that it was a small factor, but it was still considered instead of the primary or the majority factor. That's going to be a big change. The last one is the PPP applications were extended on March 25th through May 31st. It's supposed to be March 31st, and they changed it. It also allowed the Small Business Administration an additional month to process all of those applications, because in their haste to adopt the new policies, they did not include additional time for the Small Business Administration to do its job, so they had to adopt that. So those are your updates over the last 2 weeks from the Senate. Get ready, because it's going to be a wild ride. The last thing I want to tell you, and I'm going to put the policy or the codes up on the screen while I tell you this. I thought I'd have more information for you from Kentucky, except the 1 month of the Kentucky House and Senate being in session is, as I explained to you at the beginning of the year, they figure out a way to make that month last as long as humanly possible, with the very last day being March 31st. That's Wednesday. So they have until, actually I think it's Tuesday, I think they shut down tomorrow. The interesting thing is that they have actually changed the statute to allow them to extend with a 3/5 majority. The Republicans control by like 85% to 15%, so they'll probably just keep extending the legislature through the end of the year so that they can adopt things if anything comes up, because the governor won't call them into session, and now we don't know whether the governor's executive orders will be a 30-day or not. So I suspect you're going to see tomorrow the House and the Senate adopt a standing policy that they're just going to continue week to week until the end of the year, until they can get guidance from the courts as to whether the governor's policies are allowed to be without control from the House and Senate. So that's it. Questions?
Thank you, Jim. You've covered a lot of material, and there are a lot of ancillary things that are popping up now that I'm glad you're covering them. I really appreciate it.
So yeah, I covered a whole lot in the chat at the beginning of Dr. Knapp's presentation, because I was afraid we may not get to it. I'm going to give a 10-second warning. We're going to take these off the screen because Lyle likes to have time where we don't have anything up on the screen. So If you need the SHRM code, Autumn sends that out as well with the email. If you need it, get it now, because I'm taking it away, and it's gone. There you go.
All right. Thank you. A couple more chats coming in. Maybe people just saying thanks. Rita Payne, thank you. Keith Knapp, thanks for hanging in here with us. We're kind of opening the floor now if anybody wants to say anything. Keith, can you hang for just a minute in case somebody else has a question?
You bet.
Okay. So if you just want to open up your mic and say something, we're willing to chat. I see Angie Bailey is on here with her picture. Good. And Sonia Osmond, I mentioned in the chat earlier that they're both joining our team. We're excited to have them from Louisville and Paducah, Kentucky.
Thank you. Thank you.
You bet.
Keith, how do I get my children in one of these trials?
That's a great question. I'll try to find that out. I think there's a portal where you can volunteer, but I also think from that pool, they have to randomly select in order for the validity of the trial to meet FDA standards. So even if you sign up, you might not get picked for the travel team.
There was one question asked of me that I meant to cover because I think it was a great question. So let me throw this out really quick. Question was asked, can we put on an employment application that we are giving priority to a person vaccinated over somebody who is not? And the answer to that is probably not, because if you engage in punishing someone who did not get vaccinated, you could find yourself on the wrong side of a GINA/ADA discrimination. And keep in mind, Senate Bill 8, the Kentucky one that I talked about at the beginning of my presentation, which allows a conscious objector, as I call them, anyone who does not believe that they should be vaccinated, cannot be the subject of any discrimination. That's in state of Kentucky. I'm assuming the question is from somebody in Kentucky. So be careful of treating anybody differently because of their vaccinated status. I wanted to throw that out there because I think that's going to hit a lot of people. You put in an application that you are giving priority, you could be hit by the new administration's punishment of people trying to incentivize the vaccine, which they have said is illegal. And, we did have, like, Toyota was offering an incentive. Kroger was offering an incentive. My understanding is that they pulled those incentives after the new administration said that would be considered. Now, I don't know this. My understanding is, though, they went from $100 down to something a lot less because of concern over the fact that it might be considered to be an improper incentive under the new administration's policies. So just be careful. We're in a really uncomfortable time period because we're not getting a whole lot of guidance yet, but we're expected to follow it. Sorry, Lyle.
No, that's
Thought
good.
I would cover that.
Good. Okay. Other comments from anybody? Well, it's fun to see so many names we recognize on here. Thank you so much for being with us. We appreciate all your questions, and make sure anything else comes up between now and the next meeting, and I suspect we'll schedule it for 2 weeks from now. Is that the plan, Allison?
2 weeks, I think, is what I was told. I wanted to say, I got a question from Elizabeth I wanted to cover, and I also wanted to let Dr. Knapp know something. I was in Western Kentucky at WKU on Saturday for a meeting, and they have been advised locally, so check with your locality, anyone over the age of 16 in Bowling Green is eligible for the vaccine. So it's not just a state mandate, it depends on your locality. Elizabeth, your question about asking employees, absolutely you can ask your employees if they have been vaccinated. You get into problems with GINA and ADA if you ask the employee, well, why didn't you get vaccinated? Because then they might say, well, I have a family allergy to whatever, and now you just asked a GINA question without realizing it. So the caution from EEOC was, number one, you can ask vaccine, you can ask whether they are or are not. Number two, outsource it so you don't have to ask any of the pre-vaccination medical questions, because that could get into GINA and ADA. And number three, don't pry if somebody tells you, no, I have not been vaccinated. Don't try to get into pressuring them as to why they were vaccinated or why they were not. So I thought that was interesting when Western said 16 and over. So they are literally wide open. They're getting enough vaccines that they can cover everyone.
Yeah. And I've had several people, I've encouraged them to call that, in the afternoon or evening and see if there are any extras. And I've got quite a few friends have gotten in to get shots. So Keith, I appreciate that encouragement for people. Okay. Any final comments or words of wisdom? Well, thank you again for joining us, all of you on the call, and Keith, thank you for all your insights. And
I will let everybody know if we have a big blow up with the OSHA adopting the new standard and Kentucky doing some things with vetoes. We may need to meet next week, and we'll send out a notice as soon as we know. But as it stands now, I think we're looking at 2 weeks, right, Lyle?
yes, yeah,
okay.
Absolutely. If something comes up, we'll jump on it. So everyone have a great week.
Thank you, Dr. Knapp, for your information.
Let's all go get a donut.